Definitions: proctitis is the inflammation of the line out of the rectum. The rectum is muscular task connected to the end of your colon. Proctitis can cause rectal pain in the continuous sensations that you need to have a wake-up moment.
Hello, I am Dr. Rajshekhar Mysore, working as a coloproctologist for the past 25 years at Chirag Hospital and Institute of Proctology, JP Nagar, second phase, Bangalore. Proctitis causes, well, what is proctitis? Proctos means rectum. Rectum is the last part of large intestine before it ends as anus, from where motion comes out. So rectum receives all the motion, collects there, and it's like a receptacle. When it gets filled, then we get the sensation that opens and motion comes out. So inflammation of the rectum is called proctitis. Inflammation is that there is a irritation in the rectum. So that is called, in medical terms, we call it as inflammation. It may be because of some infections, it may be because of chemical irritation, it may be because of some immune system irritations. So any irritation causing in that causes redness, small ulcers, sometimes it may cause bleeding, depend on how severe it is. So proctitis, if it is acute proctitis and severe, where there may be real pain and discomfort and bleeding. Whereas there is something called chronic proctitis, mild inflammation will be there, which will be causing little irritation, and especially when they pass motion, they will have irritability in the lower end of the rectum and anal canal, or it can be recurrent. Means sometimes they will get, sometimes. That all depends on the, again, food intake and what sort of infections they are getting, worms. There are so many other causes for proctitis. So proctitis is inflammation of the rectum and even part of the anal canal, which causes irritation and pain or burning, bleeding, mucus discharge. All this can happen in the proctitis. So this specifically proctitis is to be treated with what is the cause of proctitis, what to treat. There is no surgery for proctitis. Proctitis is to be treated according to the cause, which is the root of the problem, and then it will get cured. Some of them you may have to endure, some of the proctitis you may have to use certain medicines for longer periods. And
Applications in nursing. Proving help in decisions making. Added again is when the parent is the patient in your lot of stress. Interact with the patient at regular intervals to carry out the care with him the opportunity to talk about his feelings. Discuss proceed through complication as appropriate. Use silence and listen to encourage experience, um, feeling, thought, and consent. Providing positive reformed and emotional support during the learning process and during the implementation of the value. Pros and cons. Pros: in a patient with prosthesis or UC which need to moderate activity topical termite with mescaline in concert and the fluid line their bone or units remote and the form mining it. Concept: abdominal pain, diarrhea, flatulence, nausea and vomit. Um, heart disease. Um, Chest pain difficulty. burn our legs, leading the lead to the effect on your hair.
I have been blessed with health all my life. I cannot remember being in bed with a cold or a flu or ever missing work for 50 years. So I've been very active, and I'm also stay very busy, pretty much of a high energy person.
In 2007, Mr. Crutcher presented with a complaint of rectal bleeding and proved to have ulcerative proctitis, which is a limited inflammation of the colon. Despite therapy, he progressed, involving more and more of his colon developing strictures, to the point we were unable to even pass a colonoscope through the narrowed areas of his colon.
Once that hit me, it hit me very badly, and I went from 178 pounds to 138 pounds, and I was pretty much lying in bed comatose and with very, very weak for probably 2 months.
This interfered with his functioning to a great degree, and part of our relationship was actually discussing his illness and how he was going to have to deal with this, with no understanding on our part from the beginning as to how this was going to turn out. He had not responded to the medications that were being given. He had actually had allergic reactions to some of the commonly used medications. And finally, in 2007, 2008, started the use of infliximab or Remicade, which over the period of the last 10 years has been a life-changing, life-saving drug for this man.
I will continue to take Remicade infusion about every 8 weeks. It's about a 2.5 hour total time where you go in and sit on a lazy boy chair, and either with your computer or your iPad or your telephone or take a book.
We established an infusion center so that we would have good contact with our patients while they were being infused, so it is adjacent to our office. The infusions involve complicated medications. Patients have side effects. We need nurses that are very well attuned to the medications, other complications that may be occurring, and able to assess the patient.
Dr. Rubin is number one, he's a phenomenal physician. He's well known around the country. He's highly regarded. Bedside manner, I mean, he's a soft and gentle person. Since probably June or July of '08, I've basically been free of all these symptoms, and my disease, which is chronic, will always be with me, but it is in total remission and has been for 8 years, so it's not even a factor in my life. I mean, I don't even, other than I have to go get my infusion every 8 weeks, but other than that, it doesn't play a part of my life, and I certainly owe that to Dr. Rubin getting me on this regimen.
Definitions. Proctitis in the inflammation of the line of the rectum. The rectum is muscular task connected to the end of your colon. Proctitis can cause rectal pain in the continuous sensations that you need to have a wake-up moment. Applications in nursing. Provide help in decisions making, added again in when the parents is the patient in your lot of stress. Interact with the patient at regular intervals to carry out the care with him the opportunity to talk about his feelings. Discuss perceived health complications as appropriate. Use silence and listen to encourage experience, feeling, thought, and concern. Providing positive reformed and emotional support during the learning process and during the implementation of the development. Pros and cons. Pros in a patient with prosthesis or UC which need to moderate activity topical termite with mesalite in concert and the fluid line their born or units remote and the form mining it. Concept: abdominal pain, diarrhea, flatulence, nausea and vomit. Um, Heart disease. Um, Chest pain difficulty to burn our legs, leading the lead to the effect on your heart. Use Use application in Ecuador. The problem with this theory is that in the Ecuador there is not a learning study related to this the disease, but certainly studies indicate that the method for family radio in the Howlis diet in the one zero A1 Howlis is one what one. Conclusion. Conclusions give in the similar in the clinical presentation, endoscopy, and the histological findings were infections, proctitis, inflammatory bowel disease, which is embodied the import of the clinical disorder. They include sexual rights. Ver- Veranor red trees that meet suggest different diagnostic to about the range and diagnostics for engaged hospital study. User tests and errors terrain with units consequence.
Hello, I am Dr. Rajshekhar Mysore, working as a coloproctologist for the past 25 years at Chirag Hospital and Institute of Proctology, JP Nagar, second phase, Bangalore. Well, itis when you add to any organ, it shows that there is inflammation. Inflammation is many times because of infection or it may be because of some other reason. So when there is an inflamed organ, we add itis, appendix, appendicitis, gastric, gastritis. Like that, proctitis is inflammation of the rectum, which is the last part of large intestine, which receives the motion, collects there, and from there it is expelled through the anus. So if the inflammation of the rectum alone, we call it as proctitis. If it involves the rectum and part of the large intestine, we call it as a proctocolitis. Colon is nothing but large intestine. So proctocolitis is inflammation of the rectum as well as part of the colon. The enteritis means intestines. So small intestines, large intestine are all part of the enteros. So enteritis is inflammation either of the small intestine or large intestine, or it can be total. So enteritis usually involves the small intestine. If it involves the colon, we call it as a colitis. If it is both, we call it enterocolitis. If it is stomach and small intestine, we call it as gastroenteritis. So it's all which organ is involved in the inflammatory process, we add that. So that has no meaning for the common man. It doesn't matter. Only that is the diagnosis to be made by